Meghalaya Chief Minister Conrad K. Sangma today made an assessment of COVID situation in East Garo Hills district. While assessing health infrastructure including availability of oxygen and beds, the Chief Minister urged the district administration to adopt containment and vaccination strategies to limit the adverse impact of the virus. More than 89.9% of vaccination has been completed for health workers and frontline workers in East Garo Hills for the first dose, the Chief Minister was informed. Sangma also impressed on everyone to complete the vaccination, especially for residents above 45 years old. Faith and community leaders also joined in the meeting chaired by the Chief Minister to share their opinions on how to tackle the situation in the weeks to come.
So I came to Williamnagar today to review the overall COVID situation in East Garo Hills district and particularly in Williamnagar, the headquarters. The review was attended by the Deputy Commissioner and other officials from the Health Department. And in the presentation, they give details about the current situation of COVID in the district. Overall, the situation seems to be under control as of now. There are about 44 active cases, and one of them is hospitalized as of now, but not in ICU as such. And overall, the district has approximately about 23 beds that has been dedicated for COVID, but we need to expand that, and therefore in the review we discussed on what are the requirements to expand the overall infrastructure in the district hospitals, and also we stressed on the need for vaccination and that people should come forward and vaccinate more. So we have urged the leaders of the religious leaders as well as the community leaders to help improve the overall vaccination program, and they were also part of the meeting. Apart from that, so we have urged the leaders of the religious leaders as well as the community leaders to help improve the overall vaccination program, and they were also part of the meeting. Apart from that, we also have stressed again on the fact that we need to maintain our protocol and ensure that there is no surge in the number of cases of COVID in the near future in East Garo Hills.